All right. Thank you so much for coming tonight. My name is Rachel Hill, and I'm the Development Manager at the Gateway chapter of the Cystic Fibrosis Foundation. We're excited to provide this opportunity to share a little bit more about what the support is that Compass can give for both caregivers and adults with CF. I myself am a mom of two kids with CF, and I am a huge proponent of Compass because we've had a few situations in the last 10 years where Compass definitely came to our rescue. So I'm excited to introduce to you our speaker tonight, Aaron Stocks. He's our senior manager of case management and operations at Compass. You can feel free to send in any questions as he presents so we can answer those for you at the end. And with that, I would like to turn things over to Aaron.
Fantastic. Thank you, Rachel. Are the slides up? Are they being shared? Or can you see them?
Yes, we can see them.
Very good. Well, I'm excited to be here tonight. I love coming to these presentations and talking a little bit about the services of Compass, some things that we're hearing and seeing in the community, and just kind of some reminders that are coming up this time of the year. So I tend to talk a lot. I'll try to be quick, leave some time for some questions at the end, and we'll go ahead and get started. So if you are not familiar with Compass, Compass is a team of CF patient advocates who provides this one-on-one assistance for helping people navigate insurance, financial issues, connecting to legal resources, or all other sorts of complex issues, which I'm going to dive into a little bit more very soon. Now, I use the word eligibility very loosely here because there really is no eligibility. It's for any person with CF. We've also expanded out for people with CF-related metabolic syndrome. So people who don't necessarily present cystic fibrosis symptoms in the way that we're used to, but we are recognizing that those people also need support. So expanding that out to those members of the community, people who are pre or post-transplant, family members, caregivers, spouses, essentially anyone within the CF community. And it's also important to note that we're here for providers as well. It's open to anyone. There is no residency requirements, insurance, income, or care center criteria. So someone could be seen at one of the accredited care centers, or they could be seeing a different physician. Does not matter. Compass is free and confidential. So talking a little bit more about our services. When we say personalized information and resource navigation service, conducting side-by-side health insurance plan comparisons, we like to call that kind of like our bread and butter, right? Because it's a very unique service. Not many organizations do it, but it's really important. Making a decision on health insurance is one of the most important decisions that a person with CF or any chronic condition can make. Having said that, insurance is very, very complicated in this country, and it's very there's a lot of jargon, and it's difficult to understand. So that's where we can partner, kind of translate that language and help people understand insurance a little bit better. Even if we just need to verify if something is covered under your insurance plan, or expanded benefits for additional things that insurance can cover that you might not think that it would. But we know, if you've been in this community for a while, that even when you evaluate your insurance and enroll in something that you think is going to fit all of your needs, insurance doesn't always cooperate the way that we'd like for it to in this country. So that's where we can partner with care teams, partner with you, and troubleshoot these issues, even if it's just to save you some time in getting claims taken care of, working through denials, appeals, prior authorizations, and then also connecting with financial assistance and support programs. We have learned over the years that just because you have insurance, it doesn't necessarily mean that it's affordable and that it's adequate. Oftentimes insurance plans are very expensive and therefore results in very high deductibles, high maximum out of pockets, and then along comes with very high medical bills and copays for medications. We connect people to legal resources. We partner with a law firm down in Houston, Texas, Suffian and Passamano. Many people are familiar with Beth Suffian. She has been an advocate in the CF community for many, many years. She is an expert when it comes to disability questions, Social Security, questions about having CF in the workplace and in school. So we often refer folks over to her, but we do get questions related to other legal questions. So in that sense, if it's something outside of the expertise for Beth, we'll locate some different legal organizations that might be able to provide some guidance. Providing assistance throughout the transplant journey, which is not just kind of a one-time thing, right? There's a pre, there's a during, and then even after, people need support, and it's very unique needs for transplant. So making sure that we're providing resources there, as well as educational tools and resources. We all know that every person with CF, no two people, their journey is different, or the same, right? So oftentimes people need a partner, they need someone to walk through the process with, and then other people are independent and they want to learn how to do these things on their own. So we're creating some of these educational tools and resources to be able to help navigate through these things, which live on our website now. So that's kind of the high level of what we can do. It is important to touch on a couple of the things that are a bit outside of our scope of services, right? So first things first is that we help people access medications, devices, and therapies, but that's according to the treatment plan. We don't give medical advice. And the reason being is that we don't have the medical backgrounds, we haven't had the education, and it's important for people with CF to continue to partner with their physicians and their care teams, right? They have all of the medical background, they know that person's health. So we'd actually be doing people a disservice in trying to give medical advice. Very, very important that we always refer people back to their physician or to their care team. Same thing along the lines of legal guidance. We don't have an attorney on staff. And again, we don't want to do anyone a disservice by providing any type of legal guidance. So that's why we refer folks over to Beth Stephian, or different legal resources. Another one that's kind of getting some traction is trying to understand the healthcare landscape in other countries. The people with CF, our needs are evolving. People are traveling, people are working in other countries, and so it's important to understand what the healthcare landscape is like in other countries. But unfortunately, we have just not had the proper education and training, and it's very difficult to understand what healthcare is like in other countries. So oftentimes we'll try to refer to if there is a CF organization in that country or someone who is an expert on what the healthcare looks like there. Recognizing that it's important, people should have those opportunities to be able to travel, but we just want to make sure that we're getting people to the right place. And then lastly, Compass does not provide direct financial assistance. What we do is connect people with organizations that can provide direct financial assistance, and we try to make that process as easy as possible, right? The simple example that I always give is that we don't want to be a Google. Most people can Google organizations on their own. So we try to make sure that we're providing organizations. We do the search for organizations that people might be eligible for. We walk you through what the application process might be, what needs to accompany the application process, and oftentimes working with care teams to see how we can work together in getting that submitted to make that process as easy as possible. So there are a couple of things that are just a bit outside of our scope of services. All right, so this is getting back to a couple of the things that I was talking about high level, right? Helping people evaluate insurance options, whether it be through the healthcare marketplace, evaluating plans through your job, Medicare options, or your Medicaid plans, and making sure that everything that you need is covered. And I'm going to get into that a little bit later because we're right around that time of the year that it gets pretty busy. Again, benefits and coverage. Many people may have experienced, unfortunately, these programs that are called cost relief programs, whether it be alternate funding, accumulators, maximizers. These are things that essentially insurance plans are being associated with to save themselves money, not necessarily people with CF, and it's causing a lot of administrative challenges, gaps in therapy. So finding ways to help navigate those things. Navigating provider network issues. So if you're forced into an insurance that your care team is not in network, or something happens with the contracting in the middle of the year, we can work on trying to get a network exception. Dealing with prescription denials, and more often we're seeing administrative billing challenges, particularly with specialty pharmacies. So we can intervene there. find out what the issue is, and try to resolve that. And people still using durable medical equipment, those are very expensive, whether it be a new nebulizer, a new vest, some of the other equipment that has recently come out. It's very expensive, especially if you're filling that in the beginning of the year. That's being applied to a deductible, a co-insurance. So making sure that that's and connecting people to organizations that might be able to offset some of those costs. I feel like I've talked a little bit about the legal assistance. Again, just making sure that we're providing people information to connect to the proper organizations that can give the guidance that we can, or maybe outside of Beth's expertise. And then additional resource navigation. Again, the big one is connecting to organizations, whether it be manufacturer copay assistance programs or internal hospital financial assistance or other third-party assistance programs to help minimize medically related expenses, and other service organizations to help with other life needs, which I'll touch on a little bit more in a few additional slides. All right, so let's start with choosing your health insurance plan, right? Open enrollment is right around the corner. And I said a little bit earlier that choosing an insurance plan when you have CF is one of the most important decisions that you'll make all year, right? Because care for CF is incredibly expensive. And so it can often be very overwhelming. So it's important to take a couple of preliminary steps. Again, Compass is going to be there to support you. We'll help you evaluate the plans. But these are some of the things that we would advise doing if you're going to try to do this on your own. But it's very, very important to never just make an assumption about your insurance plan. Even if it looks on the surface identical to what you were enrolled in last year, please, please, please just be sure that nothing has changed. Evaluate what you're eligible for. Even if your job is offering you insurance, take a look at other state-based programs that you could potentially enroll in. Look at the options on the marketplace or private. You'd be surprised in what other ways that you could look into insurance that might be able to save you some money and still cover everything that you need. What does the coverage look like, right? That's the most important thing that I always tell people when you're starting to look at your insurance plans. Before you even start your search, write down your priorities. What are you anticipating for the upcoming year? Have your list of medications, all of your providers. Again, I'll say this throughout the entire presentation that no two people with CF, their journey looks the same. So we're going to have different coverage needs, right? One person could need a new vest, other durable medical equipment. Another person could be starting their journey for transplant. Other people may have tune-ups throughout the year. So it's all about jotting down what your coverage priorities are. And if done correctly, if the preparation is done correctly, your plan option is going to narrow itself down for you. So then once you've identified the right plan that you feel comfortable in moving forward with, then you want to identify what assistance is available, whether it be the manufacturer copay assistance. I think folks are familiar with organizations like HealthWell, Patient Advocate, and the Assistance Fund, utilizing an HSA. I am a big advocate of HSA accounts. So just laying out what your costs are going to be are going to look like, what assistance programs you're already enrolled in, and what programs can you still enroll in to try to minimize your costs. Knowing what type of deadline that you're working up against, that's often helpful for us to share with us what type of deadline so that we make sure that we're giving like an evaluation our proper attention. And then what are the other built-in costs? By that, we mean the premiums, the co-pays and co-insurance. What are some of the costs that are not covered? Paying attention to co-pay accumulator language, meaning will your insurance allow co-pay assistance to apply to your deductible and your maximum out of pocket? So really doing a calculation of what does your cost look like for an entire year, including premiums, deductibles, max out of pocket, and co-pays and co-insurance. Then something that I'm also a really big advocate of, once you sign up for a plan and once you're enrolled and you get your new insurance card in the mail, you're not done yet, especially if you're changing insurance. If you're changing insurance, there's a whole list of things that I would recommend doing. Number one, letting your care team know. finding out if you have to use a different specialty pharmacy. You're going to need new prescriptions. You're going to need new prior authorizations. So going through that checklist and just to make sure that you don't have some sort of administrative gap in getting whatever care that you need. So these are just kind of a couple of things to think about whenever you're evaluating your insurance, and obviously a lot goes into that process. All right, and then just a little bit more about the insurance comparison process that I touched on. First two things that are usually the most important for people with CF, again, everyone's journey is different, but making sure that your medications are on a drug formulary, and that's just the fancy word for covered drug list. Making sure that all of your providers, including your doctor and the care center itself, the hospital or in network, checking a document called the evidence of coverage or in the member handbook for that accumulator language, because that may look a little bit different for all types of plans. And then again, going into those priorities, if you need a new vest, what does durable medical equipment look like? If mental health support is important to you, what did those co-pays look like? And so just evaluating for your priorities and then assessing for your assistance programs, and then weighing that premium and deductible and max out of pocket for kind of your worst case scenario for the year. Important to collect all of the necessary documentation. I mentioned something a little bit earlier called an evidence of coverage. Most people typically like to start with their summary of benefits. In that summary of benefits, it's really important to make sure that there is a link that takes you directly to the covered drug list and the provider directory. So those are really good starting points for anyone that wants to take a shot at it themselves. But of course, we're here to support you. Again, open enrollment is right around the corner. We like to call that tax time. The same thing as tax time for accountants. Very, very busy. So if you'd like some support, getting connected to someone on the team to help you through evaluating your plans, I would definitely recommend contacting us sooner rather than later, probably starting sometime next month. All right, so going a little bit further into the financial resources for medical expenses, this is not a surprise for anyone that might be listening, in that we know that CF care is incredibly expensive. So making sure that we're tapped into all of the manufacturer copay assistance programs and some of the other third-party programs that can help pay for insurance premiums and medication copays, and really tapping into some of the state-based programs. Because a lot goes into that as well. We oftentimes see that some of the state-based programs are an untapped resource, and it's a great thing to utilize, especially as some of the third-party copay assistance, it's been a little bit unstable, and so utilizing those programs, and that also gives our policy colleagues an opportunity to advocate to expand out coverage for some of those programs for people with CF. So happy to explore some of that, but this is really important because we know that insurance does not automatically mean that it's going to be affordable, adequate, and accessible. So it's important to pair this part of the process along with evaluating insurance. And then what does other life issues mean? Since the day and age of modulators, right, we're learning that the experiences for people with CF, they're starting to evolve. People are coming off of disability. People are coming off of the transplant list. More people are going to college, changing jobs, starting families. And so people there are resources out there for things like that. Scholarships, home repair programs, there's fitness programs that can help pay for exercise equipment and gym memberships. So essentially the sky's the limit on some of these things. And we want to make sure that we're leaving no stone unturned. So if there is something out there, you don't know what you don't know. So we can certainly help take a look for any resources that could be here or anything else that you might be interested in. I do always like to show up and talk about what are we seeing in some of the phone calls and the requests that we're getting throughout the country, right? Hopefully some of these things that that folks are not being impacted by, but it's always good just to get on everyone's radar. I mentioned it a little bit earlier, accumulators and some of these programs called alternate funding and maximizers, they are becoming more prevalent throughout the country, particularly with insurance that's associated with employers. So really, really important to evaluate that language. Looking for additional copay assistance, because we know some of the manufacturer programs and third-party programs, they're kind of dwindling down the availability of the funding. And we see insurance premiums increasing. Last year, I believe marketplace plans, they went up about 20%. We are anticipating another increase somewhere in between 7 to 10% this year. So making sure that we're looking into all of the available resources to help pay for insurance premiums. Again, troubleshooting medication denials. Big thing was self-funded insurance. And we would probably need a little bit more time to talk about the difference between self-funded versus fully insured insurance, but it is really, really important and to know the differences. So I would recommend calling us so that way we can help identify whether or not your plan might be self-funded or fully insured, and what does that mean. Again, resolving administrative billing errors. Unfortunately, this is a very common thing for specialty medications and some of the mail order pharmacies, so we can help there. And investigating unexpected insurance terminations. After COVID, right, they had expanded out availability for people to remain on Medicaid, and that is starting to wind down. We have learned that the unwinding process has not been very organized or very smooth. And so people are showing up to the pharmacy or showing it and realizing that their insurance has been terminated. Even when it's been communicated to them that something was sent in the mail and that they needed more information to reevaluate the Medicaid status. That system just certainly hasn't worked for people. And so unbeknownst to them, they don't recognize that the insurance has been terminated until it's too late. So again, helping people find new insurance once that happens. Again, open enrollment right around the corner. That is the busiest time of the year. And utilizing the special enrollment period for whenever you're experiencing a life-changing event. We used to say maybe 4 or 5 years ago that open enrollment, and it still is, it's very busy, but helping people evaluate insurance plans, the Compass team would tell you that open enrollment feels like January to December now, rather than just October to December. And it's because people are coming off of disability. They're coming off of Medicaid, starting families, they're moving, starting new jobs. So we've been helping evaluate insurance plans all throughout the year. And oftentimes people are changing plans two and three times per year. And then that leads to helping people try to find ways to offset some of the costs, like utilities and rent and food and transportation, because healthcare is so expensive. So these are just a couple of things to be on the lookout for, and what we've kind of seen as trends this year. And then it's always great to share what we do and how we do it, and going through the slides previously, but nothing really makes things come to life like the stories. So I thought I would put together a couple of examples, some folks that I personally worked with. A mom had reached out to us, and she was very excited. Her son was being prescribed Trikafta for the first time, and he had been on a trial. It was working fantastic, but it was one of these self-funded insurance plans. So once we tried to run the claim through the insurance, it was being denied and saying the Trikafta is not covered. What happens with self-funded plans, essentially the easiest way to understand it, is that the money to pay for the claims is coming out of the employer's pocket. It's a good way to keep insurance premiums down, but when you're talking about a drug that costs $25,000 per month, it makes it very difficult for employers to be able to afford these costs. So we had to get creative, because the employer essentially made the final decision on this. It wasn't up to the insurance, it was up to the employer. So we said, let's compromise and let's meet in the middle. Let's go get your son a marketplace plan, and let's take a look at the premium and negotiate with the employer to say, would you be willing to offset the cost of the premium rather than paying the claims? In this situation, everyone wins, because the employer is paying a little bit less for the premium than they would paying for the cost for Trikafta. So essentially, this mom got a 20% raise for her salary to be able to offset the cost of this marketplace plan. And then we connected the family with all of the programs that were out there and available to offset the costs take care of the deductible, the max out of pocket. So essentially the premium, the deductible, the max out of pocket, everything was covered. So it was a situation that worked out better than what we thought would. All right. This one I'm always excited because we're talking about scholarships and people looking for job training and looking for education. And there's some wonderful scholarship opportunities out there being provided by some of the organizations and some of the pharmaceutical companies. But again, more than half of our population is 18 or older now. And I have never met anyone with CF that doesn't have an incredible story. So these scholarships are becoming more and more competitive. Well, there's a program out there that I utilize personally. It's called vocational rehabilitation. And this program is designed to help people with disabilities gain employment. So you work together with a caseworker, and when you put together a plan, you go through an intake, they collect medical records. In this plan, it can help pay for education and job training. So this was an individual we had connected with one of those programs and paid for the entire cosmetology education and helped her find a career, find a job to get started in that field. It's a wonderful, wonderful program. It's in every state. Every county has an office. If you're at one of those points in seeking employment or going to college, it can help pay for college, sometimes the tuition, books, housing, food. Very untapped resource in most locations. So I would recommend looking into that if you're at that point. All right, almost done here. Again, I mentioned a little bit earlier, everyone's journey is very different. And sometimes you need a partner. Sometimes you need to work together with someone. Other times you want to learn yourself and you want to be independent. If you explore our resource or our website, there are some educational and self-help tools. So check out the content on cff.org. We have an insurance comparison checklist. If you want to take a look at plans on your own, jot some things down about the benefits. Navigating CF series, that's going to teach you some things about how to navigate insurance on your own. It's a wonderful, wonderful tool. It simplifies the information in the process, breaks down the jargon so that it's easy to digest. And then we've also recently launched our own resource database. So if you're looking for resources or organizations to connect with, whatever challenge that you might be experiencing, that's on our website as well. Check that out if you'd like to take a look at some resources. So we're here to partner with you and work together. But if you'd like to take a shot at things on your own, these are some of the resources that can help you do that. Good. And lastly, still a couple of methods in reaching out to us. We have an online service request form. If you would prefer not to call, or if you're reaching out to us after hours, feel free to send us an email or call us anytime. Our phone lines are open from 9 to 5 Eastern, Monday through Friday. And I think that's all of the content that I have for this evening.
And I'm muted. Sorry about that. Thank you so much, Erin. I think it's really invaluable to have all this information for our community. And I know oftentimes people are reaching out to Compass in very desperate situations, but when we know all these resources that are out there ahead of time, hopefully we can prevent some of those from happening too. So we're super thankful for all of these resources and excited to share this out to our community too. So I think we'll wrap up from there. Thank you so much, and everyone have a great evening. Thank you.
Thanks, Rachel.